afternoon. I am Olivia K. I am known as Olivia K on Facebook, Ollie K on Instagram, and also WarmEM 9800 on Reddit. So today I am going to discuss with you about the high yield medications when it comes to cardiac. So cardiac is one of the high yield meds that I think people should pay attention to, because there are a couple, there's so many where you need to know, because a lot of people have heart diseases out there such as CHFs, a lot of people have arrhythmias, current heart attacks out there. There's so many. So it's important that you know these cardiac implications for the NCLEX, so that way you are not lost. Oh my god, it's hot today, woo, and I'm so happy it is. So it's going to be loud because they're working across the house nearby, so I'm trying to make this as quick as possible because I have a phone interview in a few minutes. So I'm going to start with the antihypertensives, and I know I mentioned this before. So you have the ACE inhibitors and the beta blockers. Those two I often tell people to try to know, because of the fact that it's commonly prescribed, and there are some nursing implications that you need to pay attention to, because you're going to be teaching these patients, RNs I mean. So for ACE inhibitors, for one, you can have, some patients can have what's called angioedema, and patients who have swelling lip and tongue definitely need to report that immediately. They need to call in and say that they have these symptoms. Why? Because it's a compromise of the airway, and that's the last thing we want for these patients, and is an emergency. So they need to stop that medication immediately when that happens. Beta blocker is another medication that nurses should pay attention to, because that's something that medication you cannot prescribe to patients with COPD or asthma, because it could cause respiratory depression and distress. So going back to the ACE inhibitors, is tetragenic, so which means it causes harm to, oh, nice song in the background. So it causes harm to the fetus for pregnant women. So pregnant women cannot take ACE inhibitors at all. So that's tetragenic, just to keep that in mind with you guys. Another thing too are your diuretics. People should pay attention with them. So when it comes to diuretic, the mechanism, is that your body's excreting more fluids, and when that happens, your electrolytes are at risk for being depleted, especially your potassium. So patients need to be very careful when that they're taking Lasix. And then they have the potassium sparings, which can keep the so your spractolin, which you should watch out for regardless, because you don't want to have too much potassium either. So when it comes to diuretics, nurses need to keep in mind of looking at lab values. Okay, so that's another thing. And then let me see, for the digoxin, there's a therapeutic level. I'm forgetting the range right now. I believe it's 0.2 to 1. I'll put that in the comments when I get a chance to look at it. But with the digoxin, you want to definitely look for the level, and then you need to make sure that your patients are not seeing green or yellow halos, or not vomiting, or their heart rate is not below 60, because 60 is usually the cutoff for the digoxin. So that's something to keep in mind. So those are the few things that I need nurses to pay attention to when studying cardiac pharmacology. So the next video I'm going to go into will be your insulin, because that's another high yield topic that people should get to know and keep in mind, because it is easy to kind of disregard the onset and duration. Those are very important, because it's as a higher medication, then especially with your fast and rapid acting, your patient can go to rebound hypoglycemia if they're not eating within a certain time. So I'm going to go over those next video. And then if I have time today, I'm going to go over Love is Blind season 7 and 8. I did enjoy season 7, so I am happy to talk about that as well. Anyways, you have a wonderful day. It's beautiful out where I am, so enjoy, take it easy, and have a good one. Bye.